going to be here until 6 o'clock. But if you're not able to join us again, these sessions are recorded and they are found on our YouTube page. So it is now 5 o'clock. Let me go ahead and give you the official welcome to tonight's session. You're seeing it on your screen. It is PTSD. It is a session on trauma. It is a session on anger. And today's session is presented with our guest expert who may look familiar to you all. We've seen her a couple of times. Her name is Ines Castillo. Ines, would you like to introduce yourself?
Hello, so I'm Ines Castillo. I am a MFTT, which is a marriage family therapy trainee, but I'm also a training specialist, which means I get to do presentations on psychoeducation on topics like anger and trauma.
Thank you so much, Ines. And before we begin with the session, I want to just give you a couple of reminders. First, thank you. Just thank you for being here. Thank you for taking the time to make sure that you, as a parent, are really well equipped to handle all of the issues that are facing our students nowadays, facing our kids. It's a much different landscape than it was when we were young. So thank you for just always building your own capacity to support them. On behalf of the Board of Education, thank you and welcome. We also have our interpreters. We have two interpreters that are doing simultaneous interpretation. We have our Arabic interpretation with Miss Bayana. Thank you, Bayana, for being here. And we have our Spanish interpretation with Miss Patti. Thank you, Patti, for being here. If you need, that's right, Patti. If you need this information in either Arabic or Spanish, you should see on your Zoom tools an option that says interpretation. If you need Spanish, just change the language to Spanish. If you need Arabic, Zoom does not give us the option to designate an Arabic channel, but we've designated the Russian channel. It's the only one. I mean, it doesn't matter whether we choose Russian or Korean or French. It's not going to be titled Arabic, but if you go to that, you should be hearing Miss Bayana simultaneously doing the interpretation. And with that, I'd like to hand it over to Miss Ines Castillo from RCOE from CareSpace. And you know, parents, that we want this to be an interactive session. So as you have questions, feel free to drop them into the chat. If you have a comment, type it in. If you'd like to verbalize your comment and not type it in, feel free to raise your, there's an option that says raise hand, and then we'll call on you, and then you can turn on your microphone and then ask your question. Ines, thank you for being here. Go ahead.
Hey, RCOE. I'm a licensed child care provider. So when I heard that, I was like, oh, my people is here. Yay.
Okay. So yeah, I am with RCOE. I'm also under Latino Commission, which lets me do the presentations, but it also lets me see clients one-to-one. So with that being said, I'm going to go right into it with anger and trauma. Looking at kind of how are we feeling today? Just a little check-in for yourself. I know it's raining, it's kind of gloomy. So just kind of figure out where your headspace is at the moment. Did you just rush to get kids from school? Are you trying to figure out what to make for dinner? Did some of us grab fast food for dinner? Kind of see where your headspace is at. Just a little check-in. So starting off with what is anger? Again, as a therapist, I get a lot of parents come to me and say, my child is really angry, my child is really aggressive, like he's so upset, she's doing all of these things, her behavior is not okay. But when I go and ask parents, okay, well, what is anger? A lot of the times they don't really know how to answer that or what it looks like specifically. When I ask the child, who's my client, okay, what are you angry about? They often go, I'm not angry. My mom just thinks I'm angry. Or my dad keeps saying that I'm really angry, but I'm not. They don't get it, right? So when we're talking about anger, we get the outward appearance of annoyance, displeasure, antagonism. So for a lot of us, we start to pick up on facial cues and body language when we start to read this. And a lot of us will also pick up on tones of voice. So this is going to be really important for the parents who have children within the ages of 11 to, I want to say, 15. They seem angry all the time. They always look like they're in a bad mood. They always say something witty, sarcastic, a little mean, a little rude. And you're kind of like, what are you so upset about? You don't pay bills, right? But it's part of that developmental stage where their brain is going through a lot of changes. Hormones are also impacting the way their brain chemistry works. So their little part right here in the forehead that makes all the big decisions for them, it's actually not done cooking yet. So it's not going to stop cooking until they're 25. So if you're sitting there and you have an 11-year-old, a 12-year-old, and you're like, oh, this is just the beginning. It is just the beginning. It doesn't stop until 25 for the most part. So a lot of reasons that someone could be angry, that they could start to get angry, we kind of start to look at what are the things that tend to get us angry and what do we do when we feel angry? These are typically things that I start to ask my clients. Whenever I'm with them, I say, okay, what does anger look like for you? For a lot of my boys, I typically see a lot of outward expression. So a lot of some of my boys, depending on the high risk ones, they might kind of bang their head on walls. They might kind of want some attention. They might kind of throw themselves and might be aggressive towards other people. Where with a lot of my girls, I see a lot more of an emotional anger, a lot more maybe manipulation, some lies, a lot of fear. And whenever I ask them, what do you do when you feel angry? It tends to go back to what they see in the home. So as parents, this is going to be the really key important part. I often get parents who say, well, my child gets really angry and then they start to yell. And I say, okay, in the home, when someone, another parent, another sibling gets really angry, what do? Well, they start to yell. Okay, so you're setting the example that it's okay to yell when you're angry. Yeah, well, I don't want them to do that. Okay, then you're gonna have to not yell when you're angry. No, but fix my kids so that they don't do that, right? So a key component with anger is that children specifically will just mirror what we tend to do. So if I'm a parent and if I'm yelling all the time when I'm upset, my child is going to say, oh, well, I grew up seeing my mom yell when she gets upset. So that's just what I'm going to do, right? They tend to just kind of copy what they see in the home. So a lot of the conversation about anger really starts with us. What is something that we do? What is something or a way that we react? And how do we act? For a lot of people, when they feel angry, they actually feel hurt. So they tend to step away or they tend to kind of detach themselves from the situation. They might block someone. They might not speak to a certain person. They might have kind of like a way that they ignore the person in order to punish them. That could be their way of anger. It might not be super aggressive, but it's passive aggressive, right? So the child might start to pick up on that. They might start to ignore someone when they get angry, they get upset. So again, when talking about anger, we have to look at what are some things that get us angry and how do we react with anger? And what is our child seeing whenever we do those things? So this is a really important one. I'm going to give two separate examples onto how this works. This is called the anger iceberg. Basically, what it means is we always tend to point to anger. That's our main emotion, right? Or the main emotion that a lot of people tend to feel. In reality is, think of an onion. When you have an onion and you start to peel away the layers, you get to the core component, right? So you have anger as the very outer layer. You're going to start to peel it. As you peel it, you start to get to feelings of sadness. You get to feelings of annoyance. And you get to feelings that you feel rejected. So that's kind of what anger is like. It's like an onion. And the more you peel it, the more you get some very heavy, very hard emotions that are maybe a little bit harder to vocalize to other people. One example is, and they tend to be, for the sake of this example, I'm going to use gendered language. So a lot of the time, specifically with, let's say, men in cultures where there's a lot of patriarchy. So for example, like Latino culture, some Middle Eastern cultures, with men, they've been conditioned to only have anger because a quote unquote man is not allowed to feel sad. They're not allowed to cry. It's not okay for them based in society to have feelings of sadness. So because they grow up in an environment where someone is telling them, you're a man, you're not supposed to cry, stop crying, their default emotion is going to be anger. That's something that we tend to see a lot culturally, where a lot of our men tend to say, specifically, again, I work with a lot of Latino youth. A lot of the men really struggle with opening up and really getting to the onion layer of sadness because they don't feel safe. Now, this is also a reason why we tend to see a lot of anger with the male population, especially the middle school to high school populations. That's why a lot of the times parents come in and say, my kid's really angry. He's kicking people. He's saying mean things. He's telling me mean things, right? That's because for men in our society, it's okay if they feel angry, but it's not okay if they feel sad. A way to combat this is, again, a lot of the times we mirror what are certain contexts. So, for example, if there is a father in the house, a brother, an uncle, and they start to break down that norm of saying, it's okay to cry. I feel really sad. The child's going to start to interpret that and say, oh, like I have really strong male figures in my life, and they're able to really vocalize these emotions that aren't anger. That means it's okay. Now, this is the other interesting part. Again, we have anger on top, and we have all of these different emotions at the bottom. Typically, when I have conversations with women in practice, so when my clients tend to be women and they tend to be from all age ranges, they're able to express all of the emotions on the bottom. They're able to express that they're sad, that they feel guilty, that they feel shame, that they're really confused, but they have a really hard time expressing their anger. And again, it's kind of the opposite of the men. Women are told in our society, it's okay for you to have all of these emotions because women are emotional. But you're not allowed to be angry because angry is something that men tend to do. It's a masculine trait. So just something really interesting to point out. A lot of these times, these things tend to work differently. They're kind of like polar opposites. So for women, it might be really easy to say, I'm sad, I'm upset, but hard for them to point anger. Yes, raise a hand.
Yes, Ines, I do have a question, and I'm hoping that you might dive deeper. But I guess the question that I have now is when we see at the schools, when we see a child expressing anger, yes, what happens is that we refer them to the counselor. The counselor does their assessment of the child and is able to respond in a variety of different ways. How could parents at home help the child, whether it be a boy or a girl, um, to manage that anger? I mean, because you're right. I grew up in a Mexican household, and my dad never cried up until, now he's a little older, he's a little bit softer, and he's just more emotional, right? But barring, maybe telling all of our parents here and our fathers here, cry in front of your child, how do you suggest that we help our kids kind of deal with this anger and kind of get to the root cause?
Yeah, I think the next slide is actually one of the interventions that we tend to use a lot in counseling. It is. Okay, perfect. So one of the things that we do in counseling, we have a feeling wheel. We really recommend to use I feel, I want statements. It's a statement that helps communicate the person's feelings and what they want from that situation. So the reason why we do I feel, I want is because it reduces the blame and it also reduces kind of the defensiveness, right? So a quick example, I don't know how many of you guys have experience with partners in terms of romantic partners and washing dishes, doing chores, taking out the trash. So for example, if I tell my partner, you never take out the trash, I'm always washing dishes. I like, why don't you take out the trash? My partner is going to get really defensive and I'm blaming them, right? If I change to an I feel I want statement, I would say, I feel very tired and I want you to wash the dishes, take out the trash. So in that sense, I'm not blaming and I'm not being defensive. This is something rooted in couples therapy, but I really like to use it in family therapy as well. With family therapy, I usually tell my clients to print out, it's called a feeling wheel. You could look it up on Google. They also have a Spanish version, and you could actually put it on the fridge. And when you're having trouble communicating with the child, with your kids, you can kind of just tell them, like, look at the wheel. What are you feeling? And communicate with me through that. I feel, I want. Chances are, if they tend to have fits of rage, so for example, if the child is someone who maybe bangs their head on the wall, maybe kind of is a little bit more aggressive in their anger, the first step is actually to ground them. So doing deep breathing, getting them into a more meditated state, getting them to basically calm the body down, and then you go into calming down the mind, right? We do an emphasis on the body first because with anger specifically, I think this is also in here at a later point. With anger specifically, it's very rooted in the body. So like change in heart rate, sweaty hands, a lot of the same feelings of nervousness tend to come up with anger. But this is something that we tend to use in the communication base. And I think later on, I'll go into more detail on the body base. So when we are looking at the cycle of anger, it is a cycle. I tend to do a specific example with teachers, but I'll change it a little bit, right? The first thing is that we have an event where the child is triggered. After that come a lot of negative thoughts. They have an emotional response. Then they go into their physical response. And finally, after the physical, they have a behavior or they have an action, right? So for example, an example that I tend to give with teachers, I'll probably switch it for parents a little bit. We could have a triggering event. I don't know how many parents have multiple kids where they have siblings. A triggering event could be, for example, the two siblings starting to fight over a toy. It could be over the Switch, over Legos. Either way they start to fight, one of those children is probably going to feel disrespected, right? So if they said, yeah, you could go ahead and use it, and then they don't, they start to feel disrespected, that's going to be the triggering event. From this starts to come negative thoughts that the child might have, right? It's going to be, my brother doesn't like me. He's not letting me play with the Switch. My sister hates me. No one loves me, right? So we have an event, the siblings are fighting. We have negative thoughts. I'm not loved. They hate me. Everyone, like my sister hates me. My brother hates me. From there, you go into your emotional response. Your emotional response is going to be using one of these from the feeling wheel. So it could be feeling insecure, it could be feeling rejected, it could be feeling hurt, it could be any of these. That's going to be the emotional response. After the emotional response, we get into the physical response. This is where you start to see some kids might start to feel like they're crying, their heart might race. Some kids get red when they get really mad. It's basically the blood in our body rushing to other parts of our system. Our hands, our adrenaline is kicking, we might want to fight. As this is all going on, that's when the behavior starts to happen. So that's when you start to hear the two siblings yelling at each other. They might start hitting each other. They might criticize each other. This is where the action part starts to happen. So normally with parents, you actually don't get to see all of these. You get to see the behavior. That's when they start yelling and you have to go and break them up. But chances are all of this is happening and you don't even know. So again, as parents, it's okay. It's basically out of your control. At no point are you able to interpret or are you able to know that an event is going to trigger the child. You also don't know what's going on in the child's mind in terms of negative thoughts. And you specifically don't know what's going on in their body or in their emotional response. So something I want to tell parents, it's not your fault, and to not feel guilty that you can't stop it. Again, this is going on in the child's body, and the child already has issues communicating anger because they just kind of lack that vocabulary at specific ages. So the best we could do is start to interrupt in the behavioral response. So again, calming down the physical parts, making sure that they're breathing, their heart isn't racing anymore, to kind of prevent a little bit of the behavior. For the sake of time, I'm going to skip this. I am going to move into the brain and how the brain processes anger specifically. So we specifically have, it's about the shape of a peanut, I think. It's called the amygdala. That little peanut-shaped part of our brain actually processes all our emotions. It mainly processes all our scary emotions, so like fear, anxiety. It learns to read faces in the environment and react to them. So that little tiny peanut in our brain connects to, again, our body. Because when our body is scared and it needs to run away from something, that little portion is going to be what connects it to the body to tell it, you need to start pumping blood because you need to run away right now. That's why it's so important to really focus on physical, right? Especially with the younger kiddos, they're not going to have the vocabulary to express anger, but they're going to know that they feel it in their body. So again, our amygdala, that one's a little peanut shaped. It connects to our emotions, mainly fear, scary sounds. When we process trauma, this one actually gets overused. So when we have a traumatic experience, let's say the child was in a car accident, every time it might see a car or might get in a car, that amygdala is going to be going off. And that's why the child might start to sweat. They might say, no, 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 I don't want to go in the car. If they're really younger kiddos, they might kind of wet themselves. They might have nightmares at night about the situation with a car accident, things like that. That's because the amygdala is being overused. In terms of the frontal cortex, again, that's this part right here at the very front of our forehead. That one is used to make decisions. So a lot of the times you'll get kids, especially again within the 11 to 16-year-old age range, and they don't make good decisions. Let's be honest, they really don't. Some of them do, not all of them. And again, that's because that part isn't going to finish cooking until they're 25. That's another reason why car insurance boosts the age of the deductibles and everything until they're 25. An important part with anger is this part of the brain really shuts off with specific age ranges. So for example, with the really little ones, they don't really have that logical part in their brain. They're going to mainly react out of behavior. So a lot of the yelling, a lot of the tantrums. For example, a 7-year-old doesn't know, oh, I shouldn't hit my head on the wall when I'm upset. They're not going to know, or they're not going to go through that deductive reasoning. They're just going to hit their head whenever they get yelled at or upset because it feels like they're in control. In terms of the dorsal pons, this is another response signal that actually sends pain sensations. It starts like, it's around right here below the neck. So with the way that the amygdala sends responses to emotions, the dorsal pon actually sends pain sensations. So specifically with trauma, again, let's say there was the trauma with a car accident, a child might start to feel pain or symptoms of pain. They might say, oh, my arm's starting to hurt. I have a really bad stomach ache and my neck hurts. That might be the dorsal pons triggering that pain sensation from the PTSD. Something really important is that anger is a choice. This is something that I work a lot with my kids with, specifically middle school kids. They have this idea that, well, she made me mad, so now I'm mad. And I always have to let them know. So you know that they're making you mad on purpose, and you're choosing to let them control your emotions. That's typically a conversation that you could try to have with your kiddos. Middle school is going to be pretty resistant to that word choice or to the idea in general, but high schoolers tend to get it a little bit better. Again, something that I've been mentioning is mirroring, right? In terms of a lot of the times when we see someone angry and upset, we also get angry and upset. This happens a lot with, again, middle schoolers, high schoolers. We see the friends will have something happen to them. They get really riled up. They get upset. Next thing you know, the other student is also upset. And it's nothing bad to them. They're saying, I'm such a good friend. I'm here for you. I'm validating your experience and your emotions. But it is something really important for them to be a little bit self-aware of that. Kind of what I like to tell them, not my circus, not my monkeys. I do tell them, that's something that's triggering them, it's angering them, and you're allowing it to have an effect on your body and your response system. Something too, in terms of anger, if it's very consistent and if it's leading to really detrimental behaviors, it could have underlying issues to depression and anxiety, and it does create, again, more stress on the body specifically, which is something big that I tell the students in terms of taking care of your body. And then now we get into the fun part. For the most part, this is the slide that most people tend to look for, is looking at trauma. So when we look at trauma, we're looking at either an event, a circumstance, or something that resulted in either physical harm, emotional harm, or something that was life-threatening. It is really important, though, to note that not all trauma is going to lead to PTSD. So someone could experience trauma, but that doesn't mean they're going to have PTSD. I just want to kind of let that be very clear. For example, kiddos who are usually very young don't interpret trauma through PTSD, but maybe some of the kiddos who are a little bit older, maybe have better memory of what happened, they might have some symptomology, but we're going to get into it a little bit specifically. I did want to put this slide, so again, not to discourage anyone, in the field of therapy, we do a DSM-5, which means we actually go through all of these criteria in order to make sure that the person meets criteria for a specific diagnosis. So with PTSD, we typically have all of these different categories, from exposure, intrusion, avoidance, negative mood, hyperarousal, and the duration and the impairment of the event. For our students, typically what we tend to do is I sit down with both student and maybe even parents, depending on the age range of the student, and I go through them with this one by one. I ask them openly, you know, have you ever been exposed to trauma? Do you have distressing dreams? What's your sleep look like? Do you have any nightmares at night? How's your eating? Well, how much are you eating? Are you eating enough? And we start to go through these one by one. I personally like to take at least 1 to 2 sessions to make sure that everything is documented and in order. I also like to allow the client to ask questions and really see what areas of impairment are going on within the person's life. I do see the chats. I believe in Spanish is estrés postraumático. Yeah. So yeah, in terms of parents specifically with PTSD, I'll get into this a little bit later on. There is such a concept as generational trauma. That one doesn't necessarily lead to PTSD, but it is this notion that a lot of the times we ourselves come from trauma from previous generations, and we actually tend to pass it on as we go through generation and generation. I'll get into it a little bit later in our trauma examples.
Hey, Ines, I just wanted to make the announcement to all of our family members here that the slide deck, this presentation that you're sharing, I've put it into the chat because I know that we might be moving a bit fast in order to be able to read this. Plus, it might look a little small depending on if parents are joining on their phone. But feel free, parents, to click on that link that I've put into the chat and peruse it at your leisure. And then if you would like additional support from Ines or the CareSpace team, we can talk about how to submit a referral later. Thank you, Ines.
So this is where we start to get into the different types of childhood trauma specifically. I'll go through a couple of these. I know because it's not a very like, you guys ask me what you want to know. I'm just going to kind of pick some. One of the first ones that we actually tend to go through, and I explain to some of my students when I do this presentation with them, is grief trauma. Grief trauma, we tend to think of when we lose a loved one. It's a very traumatic event, not being able to see that person again. Something that I tell my students as well, grief trauma doesn't have to mean that the person died. For example, a lot of the times in populations where we have a lot of immigration, for example, if someone was to immigrate from Central America, let's say El Salvador, Honduras, Bolivia, and the family lost contact of that person at some point in their journey over, that could be grief trauma, where you were never reconnected with that person, you don't know what happened to them, and you just lost all contact. Missing someone in that sense could still be the process of grief trauma. We have refugee trauma, where we tend to see this, for example, with the ongoing war overseas, Ukraine, Gaza, all of these things going on, as well as refugee trauma like immigration trauma. So in terms of housing displacement, families being broken apart, a lot of insecurity in the family structure, that could lead to a lot of that type of trauma. In terms of war-related trauma as well for refugees. So for example, if someone did grow up experiencing a lot of the war effects, they might have specific trauma to loud sounds, the sirens, the feeling insecure with a lot of people, things like this. We have complex trauma that is repeated exposure to traumatic events. So for example, with the complex trauma, we start to see a lot of, this might be specific to like foster cases where maybe a foster kiddo bounced from house to house. Complex trauma could also be in regards to sexual abuse. We have disaster trauma. So for example, with Hurricane Katrina, any of the forest fires that happened recently in Los Angeles, kind of experiencing, again, the homelessness, the destruction of one's home, the insecurity of where someone might live. I know I mentioned previously for an example where someone could be in a car accident. If that person ended up being in extreme medical condition, they could actually go through medical trauma. The medical trauma is a specific one where it could happen to them or they could experience the trauma through a family member. So for example, some of my kiddos have siblings that are disabled in some way or form, which leads for the sibling to require a lot of hospitalization. The child might experience some trauma through that, specifically if that child has to step in as a translator for kind of medical judgment of their sibling. So just some examples of different kinds of trauma. If in the chat you are kind of curious about one specific one, you could pop it in and then I'll try to come back to it. Oh, something also that I really want to point out in regards to trauma. Something really important. A lot of these different types of traumas do happen to the person directly, but some of them can happen as the person experiences it, right? So again, with the medical example, just because it's not happening to the child directly and it could be happening to their sibling, they're still kind of ongoing in that process of looking at it. Earlier, I did mention generational trauma. So for example, when we look at generational trauma, we could look at refugee or terrorism trauma in the sense where maybe we know someone in the family who immigrated. It wasn't us specifically, but it was a different generation in the family. We are now acculturated and maybe our kids are the third generation, but they're still kind of lingering with that generational trauma. For religious trauma, a lot of the times we see how the child's kind of impact is the child is negatively impacted by religious trauma. I have seen some kiddos who the parent grew up in a religious cult specifically, and now the parent is very distrusting of certain groups of religions, certain groups of people. So now the child kind of, again, carries that generational trauma. So just kind of a way that we could see that through generations, we can pass down certain traumas. So when we think about what are these going to look like, how do I monitor for my child, right? Remember, not all trauma is going to lead to PTSD. However, it could lead to other things. It could lead to things like anxiety, some things like depression. We're not too sure on any of the other ones because ADHD is a little bit differently, but it could lead to more of the anxiety, depression kinds of symptoms. So looking at the age range for elementary, so parents who maybe have elementary have this age range. Again, because this age range is going to have a really hard time vocalizing and saying, I'm upset, I've experienced trauma, right? What they're going to do is they're going to kind of pull away. It's an extreme withdrawal. They're going to pull away from peers, pull away from family members. You might start to see disruptive behavior. Now, disruptive behavior might look different for everyone. So just some examples of what that might look like in the home. Disruptive behavior might be starting to fight or physically attack other siblings. Disruptive behavior could also be hitting or hurting themselves. For example, like I said, jumping off of things on purpose, hitting their heads, kind of threatening to, kind of like when they throw tantrums and they hit themselves, they bite themselves. This might be disruptive behavior. It could also be disruptive behavior in school and in class, kind of like when they're bugging other kids, they're not really doing what they're supposed to. Regressive behaviors is a really big one as well. Regressive behaviors, for example, if your child is of age 7 and they're starting to maybe wet the bed, they're having issues in terms of making it to the potty on time, that could be a regressive behavior, meaning instead of progressing developmentally, it seems like they're kind of going backwards. Of course, things like nightmare and sleep problems are going to be a really big one as to kind of what is the child dreaming of, what's keeping them up, what's scaring them. School refusal or refusal to attend school. This one could be more in lines to bullying as well. And then the biggest one that I tend to see with kids refusing to go to school is they have stomach aches. So in terms of stomach aches, a lot of the times, again, with anger, with anxiety, with all of these emotions, we see a lot of bodily sensations being attached to them. So as parents, just be very aware of what's going on when your child does know a bodily sensation, because they often can't just kind of say, I feel angry, I feel upset, I feel scared. They're gonna say, "Ooh, I feel like I have to use the restroom and like nothing's happening. My stomach really hurts. I feel like I want to throw up. I don't feel good. I'm not hungry. I lost my appetite." Things like that are going to be really important in terms of looking at their physical symptoms and trying to connect it to what they're emotionally feeling. Of course, things like anger outbursts, fighting, poor academic engagements are also going to be other signs for elementary. For middle school and high school students, this one's going to be a little bit differently. I am going to highlight substance use a little bit just because, again, within the fields of counseling, I'm starting to see substance use as young as the age of 6th grade. So just kind of want to put that out there. In terms of substance use, a lot of the times it's used to try to escape. So in the sense of they don't really know what to do with this anger, they don't know what to do with all of these emotions, and they kind of want to run away from it, but they don't know how. Because remember, they still can't vocalize it. They don't have the tools to say, I feel sad, I feel scared. So they're going to try to find a way to kind of self-medicate and get rid of those sensations. With middle school and high school, they're going to get a little bit more flashbacks. They're still going to have the sleeping problems. The emotional numbing, again, that one's going to be in relation to things like substance abuse. Emotional numbing is also going to be them death scrolling on TikTok or social media to really not be in the present moment. So they're going to really look for ways to escape. So for example, if they're playing video games, that's fine. But if they play video games from the time that they get home up until 3 in the morning, then that would be escapism. For a lot of my girls, I do notice that they kind of escape into TV shows, which again, in moderation, it's completely fine. However, if you notice that they're just kind of been watching TV shows, TikToks, Instagram, like social media, from the time that they get home up until 1 or 2, 3 in the morning, then that kind of starts to be a problem. With this comes antisocial behavior or withdrawing. They stop kind of wanting to be around their peers. This might happen slowly, little by little. It could happen due to trauma. It could happen due to bullying. It could happen due to a lot of reasons. So just kind of keeping track of, do I ever hear my kids mention a friend in their conversation? How often do they talk to them? Do I ever hear them have a phone or a FaceTime conversation with their friends? And do they ever see them after school? With this one specifically, the more detachment we start to see with the teens, the more it could potentially lead to suicidal ideation. Not 100%, but it could, depending on certain kiddos and their situations. It could also lead to a lot of confusion, a lot of guilt. A lot of the times with kiddos, especially the high school ones, they don't really want to kind of involve parents. They tend to keep it to themselves. So kind of really as parents, specifically for the high school population, opening up in a way that you're not placing judgment on what they're going to say. So what I mean by this is, for example, if a high schooler comes, and I don't have a high school child, but if I did have a high schooler child come to me and say, hey, like I haven't really been feeling great, I'm not going to respond with, well, it's because you're on that phone. Like, that's all you do. You're just on that phone. You're just on TikTok. You don't do anything in the house. You don't clean. Like, what are you so tired about? What are you so upset about? You don't pay bills, right? In that sense, I'm shutting my student down. I'm shutting my kid down. I'm not giving them the opportunity to really open up to me because I'm telling them, you have no reason to feel this way. Again, that's where the guilt, the confusion comes in. So when there is a child kind of coming up to you, starting to feel like, hey, I don't feel great, like these things are going on, exploring with them. Always be curious. What's going on? Is it at home? Is it at school? How often is this happening? For how long has this been going on? What do you tend to feel when this happens? And kind of start exploring a little bit. But at some point, if you know that you need to send it over to a professional, a school counselor, anyone else in the community, feel free to do that because again, you're still creating that supportive environment for the student. In terms of a lot of the trauma and a lot of the anger, this one is going to apply, at least the first ones are going to really apply to our smaller kiddos. So when our smaller kiddos feel like they're really angry, they've experienced things that they can't really explain, they don't know what's going on, they have a need for control. So they're going to try to control their situation as best as they can. A lot of the times, this control can be in silence. This can look like the child who isn't answering you, the child who doesn't respond to you. I see these kids all the time in the play therapy room where they just kind of sit quietly, and whenever I ask them something, they ignore me, right? That's their form of control. They say, if I don't say anything, I'm going to be safe. With this, we also see avoidance. We tend to see this one more with kind of, again, the really younger kiddos, but also the middle schoolers. They tend to avoid certain situations because it's their way of controlling it. Another really popular one right now with all the age ranges, but this one more specifically for middle school to high school, is self-sabotaging. So for example, some of my high schoolers might find very healthy relationships and friendships, but they don't know how to act or how to be in a healthy relationship when there's no yelling, there's no criticism, there's no judgment. So they're actually going to sabotage in order to be in a relationship where they actually know how to act, right? The best way to describe this is if, let's say, the child grows up in an environment of domestic abuse, the child is going to say, oh, like I see my parents fighting all the time. That's completely normal. If they end up in a healthy relationship, that child is going to go, oh, this is boring. I don't really know what to do. And they're going to actually seek kind of an abusive relationship or a toxic relationship because that's what they're used to and that's what they know. So that one's an example of self-sabotage. The other really big one is the self-critic. So that's kind of when you turn on yourself and you start to have negative language towards yourself, right? Kind of really saying, oh, what I did was so stupid, like that was so dumb, why did I do that? It's also really using your cortisol kind of as your baseline and operating from there. So now we're going to go into some anger management skills and ways that we could use anger in a healthy way. I'll try to give examples based on each kind of age range. So the first sign is to actually recognize your anger. So again, when we were looking at the anger triggers, this one is going to be more so for our really younger kiddos in the physical part. So really allowing kids to kind of figure out, hey, when I'm angry, I feel like my ears start to get really red. I feel like my breathing, it gets stuck in my chest, right? You kind of start to let them know what is it that goes on in your body when you start to get angry. For our older kiddos, it might be letting them know or letting them process what a trigger might be for them. So in our cycle, trigger was the very first one. For a lot of high schoolers, they could start to recognize starting from a trigger. And from a lot of our younger kiddos from the elementary ages, they might start recognizing from the body reactions. Our middle schoolers are going to kind of depending on the maturity level, but our middle schoolers might be a good intervention to also start with the bodily sensations. And if they're kind of mature enough to discuss, then we could kind of move them into the emotional and lead them into the trigger part. The other one is to take time. So for this one, again, we we as parents have to model a lot of these. So if we want our kids to do these, we actually have to do these. So learning to take a time out. So if I'm with my spouse, that doesn't mean that we're going to continue to yell and fight with each other in front of the kids. That means I'm going to say, can you do me a favor and can you take the kids out for a walk while I go out for my own walk, right? We're taking our separate time to cool down, and then in private we're going to discuss what we need to discuss, right? But I'm modeling that, hey, like I'm really stressed, and when my dad also gets really stressed, they just kind of leave each other alone and then they come back to discuss it. So a lot of these things we have to model for them to kind of be like, oh, taking time out isn't punishment, it's normal. A really good one to, again, really calm the body down, specifically for all age ranges, is doing deep breathing. So deep breathing, you just fill your stomach up like a really, really big balloon, and then you slowly let it out through your mouth. Aside from deep breathing, you guys can also go on YouTube and look up guided meditations, deep breathing exercises, and there's some on YouTube that are actually catered for kids if you feel like you're overwhelmed yourself, but you also need to calm your kid down. You could just kind of plop the little YouTube video on for them and then they could just kind of practice it. And it's really, I like to do this with clients too. I actually practice with them so that I could actually calm down as well. And it always works. Exercise is really important for basically, again, all age ranges within our kiddos. It's a good way for them to really get that tension out and for them to tire themselves out. So remember with the PTSDs and also with the trauma, there could be issues with sleep. So if the body is tired through exercise, there's a good chance that they're going to get a better sense of sleep at night. So for our older kiddos, thinking of late middle school to high school, expressing anger using the feeling wheel from previous slides is a really good way for them to start expressing. As a parent, if if they're expressing your anger or their anger to you, it's really important for you to just listen without placing judgment, without getting defensive, and without blaming. So if the child is kind of saying, well, it makes me really angry when I feel like this and my needs are met, right? The first thing to not do is to not say, well, I get upset too, and you don't see me complaining, and you don't see, and I have to pay the bills, and I still have to come home and cook and pick you up from school, and you don't see me doing all this, right? That's the first thing we shouldn't do, even though we really want to. It's the first thing we shouldn't do. So in allowing them to express their anger, we're signaling it's okay for you to communicate what you need, and I'm going to listen. So again, we want our kids to be in these healthy relationships later on in the future where they could fully express their needs. In terms of consequences, yeah.
Ines, can I maybe gently maybe push back on that? So you're right. We don't want to just say, well, yeah, I'm stressed too, and you don't hear me complaining. But where is the line between having our kids express their emotions and their anger and listening to them, but then also kind of helping them in developing their own empathy and understand that we as parents sometimes we are stressed and we are angry, but we can't just uh, rely on that or just stay there. How do we balance that tension?
Yeah, so this is where consequences comes in. Setting consequences and also setting limits. So for example, if the child does express, I feel really upset when X, Y, and Z. We'll say it's a situation with another sibling, right? I feel really upset that you spend more time with my sibling, right? Set a consequence and set a limit as well in terms of your sibling does X, Y, and Z, and I see that you're not doing that. And if you continue to not do it, there's going to continue to be consequences. And also setting that limit. Setting consequences and setting limits is more for their behavior, right? So looking at, I see that you're really upset and you slammed the door when you were upset. I'm going to set a limit. I'm going to set a consequence. If you don't calm down and if you continue to slam my door, there is going to be a consequence. And then state what the consequence is. That way both parties know what it is. So for example, you slam my door one more time, I'm taking your phone away. Oh, that makes me really angry. I already communicated to you that your consequence of being angry and not expressing it in a healthy manner is getting your phone taken away, right? So that's kind of as a parent where you do start to set limits. If you're at a point where you've set so many limits and you're like, well, I can't take their phone away, I can't take their Switch away, what else can I do? Consequences can also be in the form of not cooking their favorite food, not buying their favorite snacks. If they are the type of person who really likes, I don't know, like their clothes ironed, their shoes super clean, don't do that for them either. And let them know that that's a consequence of their behavior. You decided to act aggressively. I let you know that if you continue to act aggressively towards your sibling, towards this, towards that, there would be consequences. So that's where the consequence component really comes in. Visualization. So again, with this one, I recommend doing guided meditations. If you kind of don't feel up for it, it is a little bit tricky, but those can be found for free on YouTube. And again, it's a way to really calm the body down, not only for ourselves, but also for the kids. And then looking at anger in others, because a lot of the times when we're dealing with anger, it's anger in other people. So for example, again, as parents, you guys are probably in this meeting thinking about what am I going to do when my kid is angry, right? So looking at the signs of anger in other people, starting by kind of noticing, are they clenching their jaws? Are they starting to yell? Are their ears getting red? Are they starting to sweat? Kind of what's going on with the person's body so that you could kind of maybe find a way to intervene or a way to detach yourself. And also just being mindful of a lot of the triggers. So when we mention triggers, we're looking at, do you feel outside of your control? Do you feel like you can't do anything? Do you feel rejected? Do you feel like rules are being inconsistent? And with inconsistent rules, it's important that if you have a partner, both of you are on the same page, which means if I set a consequence for slamming the door, the other partner has to be in agreement. We can't be inconsistent. If I take the phone away for slamming the door, but the other partner rewards the child by going to McDonald's, then we have inconsistent rules, and that's confusing for the child as well as for us. Triggers as parents could be us just being tired and being stressed as well. Triggers for children can also be being hungry. They might not even know most of the time that they're hungry, unless they actually say something. Another trigger that's really big, specifically in the middle school and I would say the high school, is feeling embarrassed. That starts to trigger a lot of them to become upset, maybe kind of get a little bit rowdy. So starting to see, what's going on with myself, what's also going on with my student, and what are some ways that these triggers could come up. And also starting to explore what makes you feel rejected. Maybe explore with your partners as well if you guys have partners. What are inconsistent rules? Where are we not in agreement with each other when it comes to parenting? And also looking at, when do I feel more stressed? Do I feel more stressed on the weekends, on the weekdays? Kind of what's going on there. In terms of teaching our kids to disagree respectfully, we also have to learn to disagree respectfully. For the most part, it's just keeping a very open body language and a neutral face. It's really kind of using tones and empathy, using a lot of we language when you do want to kind of connect with the student a little bit more. But something important too, at the end of the day, you guys are the parents, so you guys don't have to like fully abide to all of this. But just neutral, open body language, if it's in the allowance of the space. A lot of open-ended questions. If you do kind of want to get some more information specifically, questions that won't lead to a yes or a no response. So it's not, did you have a good day at school today? Yeah. It would be, tell me about your day at school. That way the student gives you more information. In terms of kind of aiding students navigate with other people, it would be kind of letting students know, like, what are your values? What are your beliefs? Are you able to listen to people who have different values? And are you able to compromise? Again, as parents, oftentimes we tend to already have the same values and beliefs. We tend to already kind of have that background with the student. So kind of teaching them, not everyone is going to agree with you. So how are you going to manage disagreeing with someone, but still having that respectful relationship with them? And then looking at how our students, as well as us, how we can interact with angry people. Really making sure that we stay calm in the moment. So if someone's yelling, trying our best to not yell back. This includes partners, this includes kids. If my, I don't know, let's say a 16-year-old is yelling at me, I'm not going to get to their age and yell at them back. Remember, you guys are the authority figures, so you guys don't really have to partake in that. Also, being an empathetic listener. A lot of the times we get more information from our students by listening. So even if they're yelling, they're still trying to say something. So again, as parents, kids might actually be throwing like little clues in there for you when they're yelling and when they're upset. And if you really want to get information on that student, on what's going on in their lives, just kind of sit back and listen, see what you kind of hear. A big one again, setting boundaries. For us, it's going to be setting those consequences. If you slam my door, your phone's taken away. That's a boundary. Looking to avoid triggers. This one would be more for students within their own personal lives, not so much within the home life. Making sure that they do have a space to calm down. So if they're yelling, if they're getting upset, if you're just kind of looking at them like, what are you talking about? Make sure that they have a space where they could go to the room, the car, garage, wherever it could be, so that they could calm down, so that it could help you guys stay calm. And again, offering resources. A lot of the times as parents, you guys already have so much to do, and having an angry child or an angry teen doesn't help. So really looking at what point, when do I need more help? When do I need more support? Can I get that from the school? Can I get that from my family? Can I get that from other resources? And all of this to, again, as parents, protect your own well-being and protect your own emotions. And then again, I'm with CareSpace. So this is our flyer in terms of resources. We do the individual counseling. We also do a little bit of family counseling and what you just saw today, which is the parents' presentations.
Fantastic, Ines. Thank you so much for all of that really good information that you shared with us. To our families, I want to remind you that you have with the Albert Unified School District, you have a partner, and we have at every single elementary school, we have at least one counselor. At every single middle school, some of the schools have three counselors, and then at every single high school, there's about four counselors. In addition to the counselors who can support your child's uh, emotional regulation and well-being, we also have school social workers who can do group work, can do individual therapy. And then if your child needs targeted therapy, intensive support, you can reach out directly to CareSpace. There's the website and the QR code, but then the schools and the counselors and social workers, depending on the situation of the child, will make that referral with your permission, obviously, to get your child that support. Because I really love, Ines, that image that you started off with, that iceberg, that anger iceberg, that a lot of the times all we see is that anger and that lashing out, but there's so much more beneath that that we need to really uncover. So parents, just know that you can count on us to help you uncover that. It is already 6 o'clock. Now, do we have any additional questions? Anything that maybe Ines touched on and you'd like more information on, or something that she didn't touch on, just to kind of close out the session? Any questions? Ines, I do see a question in the chat. It says, or a statement. It says counseling sessions are limited at 6 per year. It would be great to have unlimited sessions in schools, especially in middle school.
So for us specifically with CareSpace, it's more of a need-based. Something really important with CareSpace, we are free. We're free because we're funded by the superintendent and RCOE. But we are typically we do a 12 session, and then depending on the 12 sessions, once those are up, we do kind of a second evaluation. We check in with the client. How are you doing? Do you want more sessions? Are you good to go? Kind of where are you? And then from there, we kind of check in. I have a couple clients that I've had for about 6-7 months now going on to this point, and it looks like they want continuing services for up to a year, which is something that we're able to do. So it really just kind of depends on the needs of the person.
Right. Thank you for that. So if your sessions are being maxed out, I'm not really sure where that is. Different organizations have different I guess limits. If it's being maxed out at 6, let the counselor know that you might need a little bit more support. And as Ines said, it's need-based with RCOE. We also have partnerships with McKinley Center, the Wiley Center. You can also, if you have health insurance, you can ask your health insurance provider to, get you some of that support. Now, there is a statement. It says middle schools have one or no counselors. To my knowledge, the middle schools have at least 2 counselors at every single one of our 4 middle schools. So if there is no there, if you're saying that there is no middle school counselor, maybe reach out to the principal to verify. But as far as I know, every single school, in elementary school, we have one designated counselor, and that is really special and unique to Alvord Unified School District. Not every district has an elementary counselor. And then on top of that, we also have all of this extra support in terms of our partnerships and our school social workers. So families, you know that this is a recorded session. You come back to it as needed. You also have the link to the session presentation in the chat. And then you also have here in front of you the information to reach out for more support from our COE CareSpace in particular. But with that, I want to just give a big, if we can give a big virtual clap and thank you to Ines for providing such great information. We got good feedback in the chat. Thank you to Pati, our interpreter for Spanish, making sure that our Spanish-speaking families have access to this information. And thank you to Bayana, our Arabic interpreter, making sure that we can spread the information even further. And with that, everybody have a good night. Yes, Sonia, I can put the link in the chat one more time. There you go, Sonia. It's there. Bye, Bayana. Thank you. Bye, Ines. Thank you for being here. Bye, everybody.